Good day everyone, my name is Shania Almanon and my co-author is Hanipa Manamparan. We are from Calumban College of Nursing. We are going to be discussing our research study entitled Experiences of Filipino Nurses Providing Palliative Care for Clients with Breast Cancer, a Phenomenological Study. This research aims to explore the unique experiences of Filipino nurses who provide palliative care to clients with breast cancer, focusing on these healthcare professionals' subjective lived experiences and perspectives. The researchers employed a phenomenological research design for an in-depth exploration of the experiences and views of the nurses, shedding light on their challenges, emotions, and the meaning they ascribe to their work.
Calumban College is located along Olongapo City, Zambales. It is composed of 6 colleges, namely the College of Computer Studies, College of Business and Accountancy, the College of Art and Science and Education, which are located at the Sinang campus. At the same time, the College of Nursing, College of Engineering, and College of Architecture are located at Barreto campus. The college is a Christ-centered Catholic education institution owned by the Diocese of Iba and driven by its vision. Guided by the Catholic faith and culture of excellence, we shall be an innovative institution of learning, extension, and research by 2025. The college is dedicated to serving the needs of Olongapo City and the towns of Zambales and its neighboring provinces.
Both existing research on palliative care and breast cancer was based on studies conducted in different cultural contexts or with various healthcare professionals. Therefore, exploring this study, entitled Experiences of Filipino Nurses Providing Palliative Care for Clients with Breast Cancer, a Phenomenological Study, aims to fill the gap by exploring Filipino nurses' unique experiences, challenges, and perspectives in this context. For the background of our study, as mentioned by World Health Organization, addressing the gap in palliative care research, palliative care is an essential aspect of breast cancer treatment, focusing on improving the quality of life for patients and their families. However, there is a lack of research specifically exploring the experiences of Filipino nurses providing palliative care for clients with breast cancer. Conducting a phenomenological study will allow for an in-depth exploration of these experiences. And according to Lehman 2019, culture plays a significant role in shaping individuals' experiences and perceptions of illness and end-of-life care. Understanding the unique cultural perspectives, beliefs, and practices of Filipino nurses providing palliative care for breast cancer clients is crucial for providing culturally competent and patient-centered care. This study will contribute to the existing literature on cultural considerations in palliative care and help healthcare providers tailor their interventions to meet the specific needs of the Filipino population, enhancing nurse-patient relationships. The nurse-patient relationship is essential in palliative care as it informs the foundation for effective communication, trust, and emotional support. By investigating the experiences of Filipino nurses, this study will shed light on the dynamics of the nurses-patient relationship in the context of palliative care for breast cancer. As emphasized by Reed, the findings can help identify the factors that contribute to a positive nurse-patient relationship and guide the development of strategies to strengthen this relationship for improved patient outcomes. And according to the study of Farrell, Professional Development and Training, palliative care requires specialized knowledge and skills to address the physical, emotional, and spiritual needs of patients and their families. Understanding the experiences of Filipino nurses providing palliative care for breast cancer patients can inform the development of targeted training programs and educational interventions. This study will contribute to the professional development of nurses, ensuring that they are equipped with necessary skills and competencies to provide high-quality palliative care. And lastly, as mentioned by World Health Organization, policy and practice implications. Research exploring the experiences of Filipino nurses in providing palliative care for breast cancer clients can have broader policy and practice implications. The findings can inform policy decisions related to the allocation of resources, development of palliative care guidelines, and integration of palliative care services within the healthcare system. Additionally, the study can provide insights into the organizational and institutional factors that support or hinder the provision of effective palliative care, leading to improvements in practice standards. For the objectives of our study, first to explore the lived experiences of Filipino nurses providing palliative care for clients with breast cancer, including their perceptions, emotions, and challenges encountered in the care of process. Next, to examine the cultural factors that influence the provision of palliative care by Filipino nurses for clients with breast cancer, including the impact of cultural beliefs, values, and practices on the nurse-patient relationship, and to identify the specific strategies and interventions employed by Filipino nurses in providing palliative care for clients with breast cancer, including the utilization of holistic approaches, communication techniques, and symptom management strategies. Furthermore, to understand the impact of providing palliative care for clients with breast cancer on the professional and personal lives of Filipino nurses, including the emotional toll, self-care practices, and coping mechanisms utilized by nurses in this context. To provide recommendations for the development of culturally sensitive and effective palliative care interventions and educational programs for Filipino nurses providing care for clients with breast cancer with the aim of improving the quality of care and patient. Our framework of the study is anchored from the bow-tie model of 21st century palliative care. We use this to describe the perceived experiences of Filipino nurses providing palliative care for clients with breast cancer. Dr. Philippa H. Hawley, a medical oncologist, pioneered the bow-tie model, which was inspired by the Canadian Hospice Palliative Care Association model. As you can see, we modified the model so that we can connect it with our study. This paradigm is a dynamic process as it aims to change people's perceptions of palliative care. The paradigm comprises of two overlapping triangles that resemble a bow tie and an arrow pointing from left to right. Disease management is represented by the first triangle and the palliative care is represented by the second triangle. Laura 2019 cited that nursing professionals should prioritize health promotion, end of life care, and most significantly, the four dimensions of healthcare related quality of life: physical, psychological, emotional, and spiritual functioning to develop and deliver successful interventions for cancer clients. Cancer can be managed using the disease management triangle. Common feelings during this life changing nursing experience is psychosocial distress. Psychosocial well-being of nurses incorporate the mental, social, emotional, physical, and spiritual determinants of health. In order for nurses to provide the best palliative care possible, we have to make a comprehensive assessment for the early identification and diagnosis and to support the prevention of disease. A cancer diagnosis can affect the emotional health of families and caregivers. It might be used to demonstrate the importance of supportive care interventions through collaborations with family and caregivers, which could help the aiding of disease progression.
The methodology. This is a phenological study as strive to achieve and seek to understand how certain nurses experience specific situation of phenomenon. To fully address the research question and learn more about experiences of Filipino nurses, this study was conducted through interviews. In this study, the phenomenon being investigated is the experience of Filipino nurses providing palliative care for clients with breast cancer. Phenomenological research design is not simply a method of approaching research. However, it is an intellectual process that includes viewpoint and life experiences that are used for a deeper understanding of human being and existence by investigating phenomena. The study took place at Olongapo City, specifically James L. Gordon Memorial Hospital, a tertiary training level 4 hospital. To conduct a more comprehensive study, criteria was set when choosing target participants. The researcher was able to interview a set of Filipino nurses about their experience and how they fully intend to integrate them to clinical practice. Palliative care is the anticipated outcome of active nursing care, and the design and administration differed significantly depending on the interview. The research study employed qualitative interview. The research used the type of instrument suited to perform the investigation process, which is via Semi-structured and deep interview style in which the respondent is given more leeway to determine what is significant to highlight rather than being forced to answer. Out-restrictive interview question by the researchers. It is a distinct type of interviewing based on the phenomenological theoretical lineage. We also made use of a variety of question guides, including those based on background, experiences, views, belief, knowledge, and sensory experiences. The emphasis on the research question and the questions that are formulated are specifically geared to provide answer to it.
Now, let's proceed to the results and discussion. The researchers sought to investigate the experiences of the nurses when giving palliative care for clients with breast cancer. The needs of the patients are taken into account. In order to build a strong nurse-patient relationship and provide effective nursing care, empathy is vital. Furthermore, nurses noted that all clients with breast cancer required positive reinforcement of comfort care. The requirement for professionalism when dealing with clients and offering emotional support was also mentioned by the nurses. For nurses to establish nursing care plans that are intended to improve health outcomes, complete data, including social determinants of health, spirituality, and lifestyle, is gathered for use in the assessment of nursing classifications. Nurses develop coping methods that can adjust their ideas, behaviors, perceptions, and emotions to manage interruptions of psychosocial homeostasis. One important aspect of palliative care is providing motivational care, which involves helping patients finding meaning and purpose in their lives despite their illness. Collaboration between nurses and the families of clients is essential to gaining trust between family and nurses. To increase the accessibility of nurses toward family, especially clients, and to improve recognizing and exploiting family caregivers as partners in the care of clients with breast cancer regarding making decisions. Nurses gather data between the patient and the family members addressing the family concerns, which required good communication and giving information to build trust in the family of clients. And being able to offer patients and their family support during difficult times is essential to the nature of palliative care, and it relies on sharing information to develop and implement care plans. Interdisciplinary cooperation is also essential to nursing practice in order to provide true patient care. Researchers are also seeking to learn about the difficulties that nurses face as they work through different phases of palliative care for patients with breast cancer. Lastly, nurse communication is one of the most difficult challenges within the healthcare sector. Effective nurse-patient communication improves patient happiness, compliance, and results when done correctly.
For discussion of our study, Filipino nursing professionals have a pivotal function in delivering healthcare services to breast cancer patients at various stages of the disease. This thematic analysis aimed to explore the experience of Filipino nurses in handling clients with breast cancer in relation to different stages of the disease. The relationship between nurses and the patient is the foundation of nursing care across the continuum of well-being, sickness, and recuperation. The nurses take charge in establishing this relationship, which is centered on the patient and aimed at achieving specific objectives. On the top of that, when providing nursing care to patients with breast cancer, Filipino nurses must contend with various levels of psychosocial distress. To deal with this stress, they employ a variety of techniques. In the course of their routine work, nurses provide continuous support to their patients with breast cancer, assisting them with their daily tasks to maintain patient health resulting in mental exhaustion. It was observed that effective communication among co-workers and team members as well as getting enough sleep is an essential self-care strategy, which can enhance the nurse's mental well-being. Practices of mindfulness such as meditation and breathing exercises support nurses in escalating their consciousness of their thoughts and sentiments. Nurses play a crucial role in helping patients with breast cancer feel motivated to take back control of their lives. Breast cancer patients' intrinsic drive to survive serve as an incentive for recovery, and the sense of optimism they develop over the course of their lives serve to amplifying this motivation. Nurses may support patients in reaching their desired quality of life by supporting them in identifying their objectives and priorities. encourage them to participate in activities that make them happy and fulfilled, and provide motivational care. Significantly, Filipino nurses play an essential role in collaborating with the family of breast cancer patients throughout their journey. In order to establish trust with the client family, nurses gather information from the patient and family members while addressing their concern. This needed strong communication and information sharing. In light of the nursing experiences, communication hurdles may obstruct efficient communication between the nurses and cancer patients who required clear and comprehensive information in order to make decisions regarding their care and treatment. On the final note, Filipino nurses face several challenges and ethical dilemmas when handling breast cancer patients. There are times when the ethical principle of autonomy and beneficent conflict. When handled improperly, this situation may raise issues with law in addition to ethical or moral ones.
Now, jumping to the conclusions of our research study. Filipino nurses who provide care to patients with breast cancer face numerous challenges, such as inadequate resources, limited time, and impediments. Nevertheless, they prioritize addressing these concerns and providing excellent care to their patients. They utilize various methods to maintain a professional distance between themselves and their clients, such as nonverbal signals, humor, courteous, and professional behavior, transparent communication, and coping strategies. By employing these techniques, they are able to uphold their professional boundaries while still giving their patients the essential attention and assistance. Nurses assess the needs of breast cancer patients through a patient-centered approach that takes into account the physical, emotional, social, and spiritual aspects of care. Moreover, they formulate a comprehensive nursing care strategy through the use of the nursing process, collaborating with patients and their loved ones, and coordinating with other healthcare professionals. Filipino nurses have played a crucial role in attending to patients undergoing treatment for breast cancer. The significance of their work cannot be overstated, and it is essential that we prioritize their well-being as well. Caring for clients with breast cancer can be an emotionally and psychologically taxing experience for Filipino nurses. So, it is important to provide our nurses with a supportive environment that prioritizes wellness and welfare. The experiences of our nurses when caring for clients with breast cancer are intricate and involve emotional distress, communication difficulties, challenges in providing care, coping strategies, and education and training. The findings emphasize the importance of healthcare organizations offering support programs that prioritize our nurses' emotional well-being, enhance their communicational skills, provide comprehensive care, and offer continuous education and training to improve their competence in dealing with breast cancer patients. Moreover, it highlights the significance of preserving patient privacy and confidentiality in breast cancer treatment, especially in the context of traditional or cultural norms.
For recommendation of our study, the researcher provides recommendation for future researchers interested in analyzing palliative care for breast cancer patients based on the findings, as well as guidance to help future researchers with their work and contribute to the advancement of this important field. Measurement and complexity provide chances for study and innovation, as well as the potential to refine and shape the palliative care of the future. By investigating innovative interventions, exploring new approaches to delivery care, and assessing the impact of various psychosocial and cultural factors, we, the researchers, will contribute to an expanding body of knowledge that can guide evidence-based practice and policy development. Our findings can be used as a guideline and source of information for future research. Additionally, conducting more empirical investigation with larger sample sizes and broadening geographical representation could support the verification of specific aspects of the model proposed in this study that serve as a better representation of the population, thus yielding more precise outcome. These are the reference of our studies. And once again, I am Anika Manamparan and my co-author is Tranaya Almanon. Thank you for listening to us.